By the end of this presentation, you will learn about COVID-19 and how it's spread, the benefits of getting vaccinated, vaccine safety, vaccine myths and misconceptions, and the best way to protect yourself from COVID-19. COVID-19 is a new disease caused by a novel coronavirus that has not been previously seen in humans. People of any age, even healthy young adults, can get COVID-19. But the risk for severe illness with COVID-19 increases with age, putting older adults at the highest risk. Certain medical conditions can also increase risk for illness. People at increased risk, and those who live or visit with them, need to take precautions to protect themselves from getting COVID-19. COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other. People who are infected but don't show symptoms can also spread the virus to others. Although most people with COVID-19 get better within days to months of the illness, some people do not. The CDC uses the term post-COVID conditions to describe health issues that persist for more than 4 weeks after being infected with COVID-19. People can continue to experience some of the following health issues post-COVID: tiredness or fatigue, difficulty thinking or concentrating, headache, loss of smell or taste, dizziness, depression, anxiety, fast breathing or pounding heart, chest pain, difficulty breathing or shortness of breath, cough, joint or muscle pain, and symptoms that get worse after physical or mental activities. According to the CDC, the COVID vaccine can keep you from getting sick with COVID-19 and can reduce the risk of COVID-associated hospitalization. The vaccine has been shown to reduce the severity of illness in people who get vaccinated but still get sick. It may protect the people around you who are the most vulnerable to serious illness, and might enable you, once you are fully vaccinated, to start doing some of the things that you would stop doing because of the pandemic. Is the vaccine safe? COVID-19 vaccines are safe and effective. The vaccines were evaluated in tens of thousands of participant clinical trials. The vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support emergency use authorization. The mRNA and viral vector technology have been studied for decades. Recent advances in this technology made it a great solution for this vaccine and can be produced quickly. Both the Pfizer and the Moderna vaccines require 2 doses and use the mRNA technology, while the Johnson & Johnson vaccine only requires 1 dose and uses the viral vector technology. Some common side effects of the vaccine include muscle soreness or an aching arm, as well as a low-grade fever, chills, headache, or fatigue. The vaccines cannot give someone COVID-19 because the vaccines don't use the live virus that causes COVID-19. The vaccines help your body create blueprints that stimulates the immune system to prevent COVID-19. Is it safe for me to get a COVID vaccine if I'd like to have a baby one day? Yes. If you're trying to become pregnant now or want to get pregnant in the future, getting a COVID vaccine is safe. There's currently no evidence that a COVID-19 vaccination causes any problems with your pregnancy. In addition, there's no evidence that fertility problems are a side effect of any vaccine, including COVID vaccines. Will a COVID vaccine alter my DNA? No. COVID vaccines do not change or interact with our DNA in any way. The vaccines deliver instructions to our cells to start building protection against the virus that causes COVID-19. However, the material never enters the nucleus of the cell, which is where our DNA is kept. This means the genetic material in the vaccines cannot affect or interact with our DNA in any way. After getting the COVID-19 vaccine, will I test positive for COVID on a viral test? No. None of the authorized and recommended COVID vaccines will cause you to test positive on any of the viral tests. Can a COVID-19 vaccine make me sick with COVID-19? No. None of the authorized and recommended COVID-19 vaccines contain the live virus. This means the vaccine cannot make you sick with COVID. The COVID-19 vaccines teach our immune system how to recognize and fight the virus that causes COVID-19. It can be possible to be infected with the virus just after getting a vaccination, but this is because the vaccine has not yet had enough time to provide protection. If I already had COVID-19 and recovered, do I still need to get vaccinated? Yes. You should be vaccinated regardless of whether you had COVID-19 or not. That's because experts don't yet know how long you're protected from getting sick again after recovering from COVID-19. Even if you already had recovered from COVID-19, it's possible that you could be infected with the virus again. Getting vaccinated, wearing your mask regularly, washing your hands frequently, and practicing social distancing are all ways that you can prevent the spread of COVID-19 and protect the people around you. Here are some general guidelines for mask wearing. Make sure your mask is over your nose and mouth. Make sure you're wearing your mask in public settings or when around people you don't live with. And wear a disposable mask underneath your cloth mask. Make sure you are not putting your mask on your neck or up on your forehead. Do not touch the mask, and if you do, wash your hands or use hand sanitizer.
First came the virus that had never been seen before, and that spread faster than we could ever imagine. Now we hear there's a safe and effective way to stop it. Vaccines that will protect millions from COVID-19. But can we really know they're safe after less than a year of testing? COVID-19 vaccines may be new, but vaccines are not. We've been using vaccines to protect against infectious diseases for over a century. 2 COVID vaccines are the first authorized vaccines ever to use a new technology, but even that technology, called messenger RNA, has been tested and studied by vaccine researchers for decades. We've learned how to make vaccines better and safer, and we've applied all that knowledge to COVID-19 vaccines. We also had a head start on COVID vaccines thanks to studies the National Institutes of Health had done. Scientists there actually created a vaccine that could be custom-made to fight different strains of coronavirus, like the virus that causes COVID. Using these studies, they were able to make a COVID-19 test vaccine just over a month after the disease was first reported. All vaccines have to be thoroughly tested before they can be marketed. During clinical trials, scientists measure and compare data on volunteers who receive a vaccine to those who receive a placebo, like an injection of saline. Most early clinical trials involve fewer than 3,000 volunteers, so it can take a year or more to get the data needed to measure how well vaccines work. Early clinical trials for COVID vaccines enrolled at least 30,000 volunteers each, so data on safety and performance were collected and analyzed in under 4 months. Vaccines are usually developed one step at a time, and companies wait until they have final approval to start manufacturing them. But addressing this pandemic couldn't wait, so government and industry invested millions of dollars to produce vaccines at the same time their test data was under review. This meant health departments and clinics started getting vaccine shipments a few days after the Food and Drug Administration's rigorous standards for safety were met, and the vaccines were authorized for public use. Thanks to extraordinary advances, science, industry, and dozens of government agencies have been able to work together to produce and deliver safe and effective COVID-19 vaccines in record time. Decades of experience and innovation led to this achievement, one that can keep you, your family, and your community safe from a serious and dangerous disease. Learn more, cdc.gov/coronavirus. We can do this.